How to manage hygiene with Roman 4 antibiotics for diverticulitis. Managing hygiene while receiving intravenous antibiotics for diverticulitis is vital for preventing infections and ensuring effective treatment. When diverticulitis is severe, intravenous antibiotics are often necessary, and maintaining proper hygiene is essential for the Roman 4 site and overall health. First, hand hygiene is crucial. Always wash your hands thoroughly with soap and water, or use an alcohol-based hand sanitizer before touching the Roman 4 line, medication, or any related equipment. This practice helps reduce the risk of introducing harmful bacteria to the Roman 4 site. Next, focus on Roman 4 site care. Keep the insertion site clean and dry. Regularly check the site for any signs of redness, swelling, pain, or discharge, as these may indicate an infection. Follow your healthcare provider's instructions on changing the dressing, which is typically every 48 to 72 hours or sooner if it becomes wet, dirty, or loose. When changing the dressing, use a sterile technique. This means wearing gloves, cleaning the skin around the Roman 4 with an antiseptic like chlorhexidine, and applying a new sterile dressing. Avoid touching the part of the dressing that will contact the skin or the catheter to minimize contamination. During bathing or showering, protect the Roman 4 site from water exposure. Use a waterproof barrier or plastic wrap secured with tape to cover the Roman 4 site. It is important to avoid submerging the Roman 4 site in water, such as in a bathtub or swimming pool, until the Roman 4 is removed and the site has healed. To avoid contamination, do not touch the Roman 4 catheter or tubing unnecessarily. Keep the tubing secured and avoid kinks or pulling that could dislodge the catheter. If the tubing or catheter becomes contaminated or damaged, contact your healthcare provider immediately. Monitoring for signs of infection or complications is also essential. Report any fever, chills, increased pain, redness, swelling, or pus at the Roman 4 site to a healthcare professional promptly. Early detection and treatment of infections are critical for recovery. Maintaining good personal hygiene is equally important. This includes regular bathing while taking precautions for the Roman 4 site, oral care, and wearing clean clothing. Good hygiene supports the immune system and reduces the risk of secondary infections. Lastly, always follow medical guidance. Stick to the prescribed antibiotic regimen and attend all follow-up appointments. Your healthcare provider may give specific instructions tailored to your condition and the type of Roman 4 antibiotics you are receiving. In summary, managing hygiene with intravenous antibiotics for diverticulitis involves careful hand hygiene, diligent Roman 4 site care, protection during bathing, avoiding contamination, monitoring for infection signs, maintaining personal cleanliness, and following healthcare provider instructions closely. These steps help ensure effective treatment and minimize complications.